My name is Paul Jacob. I'm an orthopedic surgeon in Oklahoma City, Oklahoma. I primarily focus on adult reconstruction, hip and knee replacement. I started my career in medicine as a physical therapist, primarily focusing on orthopedics. And after a couple of years of doing that, I realized that I loved what I did, but I wanted to be able to do more. So I went on to medical school and residency in orthopedic surgery, and then did my fellowship at the Cleveland Clinic in adult reconstruction.
Do you consider potential metal sensitization an important issue to discuss pre- or post-operatively with your patients?
Without question, I think that's an essential topic to discuss with patients, and whether you bring it up or not. Most patients have thoughts or concerns regarding this topic, so one thing that I found is it's best if I can kind of guide the conversation. So I'll bring it up first. I'll go over my thoughts. I really try and keep my personal comments to myself. I really try to present the science and the data. And then beyond that, I give the patient as much information as I can to allow them to make their own decisions. I do have a metal testing consent. So if the patient, it has an informed consent portion about metal sensitivity and metal testing, the differences between types of metal testing, and then the advantages and disadvantages of all of that. And I do have them sign a consent form whether they choose to go on to testing or whether they waive the testing.
How has Orthopedic Analysis metal-LTT testing helped patient outcomes in your practice?
As an orthopedic surgeon, I would say I have, a base understanding of hypersensitivity types and the basic science behind those, but it never made a whole lot of sense to do skin patch testing for my patients for metal sensitivities when I'm not putting that implant on or around their skin. And so when we start looking into type 2 and type 4 hypersensitivities and the knowledge and basic science behind those things, I found that the lymphocyte transformation testing was really the only way that I felt comfortable moving forward with a reasonable option for my patients as far as testing goes. The skin patch testing may help, may not help, but it didn't instill confidence in me, and therefore I portrayed that lack of confidence to my patients. And often I felt like in those scenarios, I'd rather just, if they're worried about it and they think they might have hypersensitivity, I use a non-nickel or non-cobalt implant as best as I could. I really do think, though, that the testing is important, not because nickel isn't the only metal sensitivity out there. And so testing for everything, including the polymers and the bone cement and all of that, is really an important aspect. I'm always surprised when I get a high reaction to cobalt or chromium, which are in far greater percentages in the implant than nickel. And that to me is even more important than the positive or negative nickel test.
Which patients should consider metal sensitivity testing?
In my instance, I don't know that there's a patient that shouldn't consider the testing. I really think, just from a peace of mind standpoint, wondering after surgery if you're having a poor reaction or maybe not the outcome that you were hoping for, sitting there and wondering, hey, could this be a reaction to the metal? Could I be reacting to some substance that was placed in my knee? That's a bad spot to be in, and it's a tough hurdle to jump for surgeons. Even if we don't believe that it's the implant causing the issue, I never want to be stuck in that situation. I always want my patients to say, well, hey, listen, we talked about it, you offered it to me, and I chose to pass, versus, hey, why didn't we talk about this? Why wasn't I offered this testing? Why didn't I know about this? That's a really bad conversation to have, and it's hard to get beyond and rebuild trust in that scenario. So I talk to every single patient about it. I offer it to every single patient. I give them, like I said, as much information as I can to help them make the best decision for themselves, and then we move forward with whatever they decide to do.